A very good evening, everyone, and welcome to today's workshop. So, we will wait for another 2-3 minutes while others join in. Do let us know in the chat what brings you to this workshop, any health concern that you have. We will try to cover as much as possible, talking about the most common chronic ailments, but it will be good to know in the chat what brings you. Good evening, Prashant ji. You can let us know in the chat what brings you here. Nilofer says rheumatoid arthritis, thyroidism, hypothyroidism, RA, ankylosing alopecia, vitiligo. Thyroid disorders, high IgE, okay. How about the others? So we see a lot of people here because of thyroid disorders. So hypothyroidism, beginning stage, skin rashes when exposed to sun and TV light. Okay, or maybe you meant UV light. Okay. So most of you here have shared, some or the other autoimmune condition. Now, how many of you were also, when you had this diagnosis of an autoimmune condition, it was also told to you that now you only have to be on medications for life? Okay. I see two people saying yes. Okay. So it's commonly said actually, so that, you're diagnosed with an autoimmune condition. Well, you cannot do anything about it. You just have to be on medications. So, and you will see as you are taking medications, but then despite that, over a period of time, the disease is still progressing. It's not improving. Your symptoms are not improving. The disease is progressing. So why is it that I mean then basically this medications you are taking are just kind of somehow managing few of your symptoms, not all for sure, while it's not doing anything to the progression of the disease. So today's workshop is all about understanding what is really contributing to an autoimmune condition. Unless we understand why you have autoimmunity, you were healthy all this while. You were not born with this problem. You were healthy until 25, 30, 40 years of age, and then you developed it. Of course, it did not happen overnight. It was a process, but definitely something has contributed to it. Your choices, your day-to-day choices, many of them may be conscious, unconscious choices, have contributed to it. So in today's workshop, we will be sharing our experience, our knowledge about autoimmune conditions, and how can we actually address it and stop the progression of the condition, improve the quality of life. So I'm Dr. Ruhi Agarwala, and I have with me my colleague, Mr. Siddarth Goel. So in our program, we have been working with a lot of people struggling with autoimmune condition. I come from a medical background, so I've done my MBBS, but then I didn't want to continue further with it because I was not really making a difference in people's life by treating the symptom, by managing symptoms rather. So I moved to pursue global health so that I can move more on the preventive side of health. But again, that did not give me answers to what I really wanted to do. And I finally found my calling in functional medicine, which gave me the tools to really identify the root causes of chronic conditions and fix them with a holistic approach. And that's what I do. Have been doing for the past few years. And with whatever I've done, the people that have worked with me, it's overwhelming to see the difference in their lives now. And I have with me Mr. Siddarth Goel. Siddarth, over to you.
Thank you, Dr. Ruhi. Namaste, good evening, and a warm welcome to everyone. Thank you for taking out the time on a weekday evening to join us for this workshop. So, I am Siddarth. I am an MBA. I worked in the corporate sector for a decade, but my heart wasn't there. Okay, I was doing whatever I was doing, but my heart was in health and well-being and spirituality. So it was 11 years back now that I moved out of that career and I started, studying health and functional medicine. So over the last years, I've worked with a few hundred people on a one-on-one basis, and then a few years back, we came together to, jointly create this program. It's been a very fulfilling journey where, we have been able to turn around the lives of literally hundreds of people who had given up hope and who were just kind of existing, managing, dragging themselves from one day to the other. And these same people today, we have cases where people who they had multiple autoimmune disorders and crazy symptoms and a bucket load of medicines every day. And a few months of working with us, they're off medication, their energy levels are back, they're full of enthusiasm for life. We have middle-aged, patients who were on antidepressant medication for 5 years, 10 years. In spite of that, no enthusiasm, no energy to do anything. And a few months of working with us, they are doing trekking to the Everest base camp, right? So for me, that is the real wealth in life, not just money, that we are able to bring about a huge difference in people's lives. So with that, little bit of a background and introduction, let's kind of dive into the session that all of you have come today to hear us, speak about. Okay, so let's start and, just look at a couple of very common myths about autoimmunity. How many of you have been told that autoimmune disorders are genetic in nature? You can reply with a me in the chat. Any people like that? Oh, sorry. Okay, so I see quite a few knees starting to be Nilofer, Tanya, and Kalim Banu, Prashant, etc. Okay, so thank you for replying. So let me explain to you the reality. So many of you might have come across the term called epigenetics, right? So epigenetics is a science of studying the interaction between genes and environment. And this science is telling us that our genes are not cast in stone, okay? True genetic diseases are very rare. So all of you might be aware that the royal family of Britain, they're called blue-blooded because genetically there is a mutation in them, in their bodies, where the body cannot do blood clotting. So even with a small cut to death, okay? So that is a true genetic disorder. Rest of these, there may be a slight extra possibility that one person may get into autoimmune disorder compared to somebody else, but that's all. That does not account for more than 15 or 20%. The rest is always the environmental choices, the lifestyle choices that we make. So just one second. Okay. Okay, so autoimmune disorders are not truly genetic. Genes can only play a role where they increase the possibility of one person getting autoimmune disorder compared to someone else. Okay. And the other thing is, this is a question that Dr. Ruhi already asked in the beginning, that you will have this disease for the rest of your life. The only thing we can do is to help you manage your symptoms with these expensive medication, which obviously have side effects, right? But we can't do anything about the disease itself, right? So once again, not true, because let's understand a very simple reality of life, that we are in this physical existence. Everything is working on the principle of cause and effect, right? So there has to be a cause which created the effect of autoimmunity in the body. If you remove the cause, the body has the ability to heal itself. Yes or no? See, till the last day we die, we might live to 90 years of age. If we get an injury or a cut, does the body heal itself? It does, right? So why will it not heal something which is not working properly inside, internally? That also it can heal, provided we give the body the tools that it needs to do that, and we remove what is preventing the body from doing that. Okay. Although the science is obviously very complicated, but actually boils down to just this. You give the body what it needs and you remove what is hurting the body. The rest of the work the body will do. You don't have to heal the body. There is no medicine which can heal the body. Such a medicine does not exist. The job of a medicine is only to ensure that the body is able to do its job of healing itself better, to support the body in that direction. Does it make sense? Yes, yes or no? Body is a self-healing mechanism, isn't it? And it is the most advanced piece of machinery in this existence. Why will it not heal itself? Because it doesn't have what it needs to do that job, or something else is preventing it. That's all it is, isn't it? So with that, let's look at the conventional thought process. We said conventionally they say it is an incurable genetic disease, and you need a lifetime of medication, which obviously will create their own downstream problems. Whereas the functional medicine approach is saying that there are reasons behind everything that happens. Nothing happens without a reason. And the reasons or the root causes behind autoimmunity are chronic stress, viruses overload in the body, bacterial fungal overgrowth, medicines, hormonal imbalances, nutrient deficiencies, and toxins, etc. Right? So in other words, you can think of it like this, that genes can load the gun, but to pull the trigger or not is your choice, and that depends upon these environmental factors. Yes. One very important thing I want to address, and I want all of you to, maybe pay attention and get this properly. Many times people will go on asking us, in the Q&A section, okay, I have this disease. Is it reversible? I have that disease. Is it reversible? It doesn't matter what is the name of your autoimmune disorder, because that is only dependent upon which part of the body or which organ the immune system has attacked and damaged, right? We are not working on that level. We are working at a level which is much deeper than that, which is, why is the immune system behaving like that? Instead of protecting the body, why is it attacking the body? Right? Once we are able to address those factors, whatever part of the body it is attacking, it will stop doing that. Yes, isn't it? So whatever be the label, the name of your disease, it doesn't matter. If you identify the root causes and you address them, you make the required changes to address them, the body will heal itself. It will stop damaging and heal itself, right? So let us look at, so there are a total of 10 root causes that we will discuss. Let's look at the first one. The first is diet. See, you may know this intuitively or subconsciously at some level. You may not have thought about it consciously like this. What is this body made up of? Physical body. Anybody? Quick answer in the chat. What is it made up of? Quick. If we keep waiting, then a lot of time will go. Cells is fine, but what the cells are made up of? Right. So Vanshika is right. Proteins, carbs, fats, minerals, vitamins, etc. Essentially food, right? All of these things are supposed to come from food. Water is also part of food only, right? And finally, yes, it all boils down to the 5 elements, right? But essentially, this body is made up of the food that we eat. What kind of food are you eating? How you're eating it is going to decide what kind of body you manufacture, isn't it? Very simple thing, right? You don't have to be a scientist to understand these things, right? So if you are eating a diet that is high in refined carbs and sugars, right? Gluten and dairy, which are highly inflammatory, they elicit an immune response, right? Processed foods, which have empty calories, no nutrition, only calorie, right? Or you are eating a diet that is high in seed oils, refined oils, trans fats, and you're not consuming the healthy fats which are essential, right? And protein is not there sufficiently in your diet. It is low in antioxidants because you don't eat a good variety of fruits and vegetables. You don't drink the right kind of water. Naturally, the kind of body you are creating will be a challenge, right? It will not have the raw material to function properly to heal itself. Going back to what I said earlier, you give the body what it needs, you remove what it doesn't need. Correct? The most important category in that is the food, because the body is made up of food. Actually, in Ayurveda and yoga, the physical body is referred to as kosha. Kosha is layer. So they talk about the system as, layers, physical layer, mental layer, like that. And anna is the food that you eat. So layer, which is made up of food, right? Moving forward, uh, toxin load. See, today we are referring to our society or this time as the information age, right? We can also refer to this time as the toxic age. The amount of toxicity our industrial activity has created in the environment, it is crazy, the amount of toxicity, isn't it? So toxins come in many ways. Overgrowth of bacteria, fungus in the gut, in the body, produces a lot of toxicity. Drugs can be life-saving. They may be needed, but we cannot, we have to accept the fact that at some level, they are all toxic as well, right? Agricultural chemicals, all pesticides, fertilizers, glyphosate, right? Wherever the suffix side is added, side essentially means a poison, right? So something that is poisonous enough to kill those small, insects and all, it may not kill us immediately, but it will definitely be toxic to the body at some level. Air pollution. Now, when we talk about air pollution, we always think about outside air, right, on the roads and all. But what we don't realize is that the amount of pollution in our homes is also quite crazy. We don't realize it because there is not enough information out there, on the internet and newspapers, etc., about it. But many of our homes are actually highly toxic, and most of that pollution is coming from the furniture that we sit on. A lot of volatile chemicals are used in furniture which are always outgassing, and we are inhaling that. And we don't, keep our doors and windows open, so there's no circulation happening as well. Asbestos, well known. BPA, well known toxin. Phthalates used to make plastics flexible, and we give these flexible toys, to children, and they always put everything in their mouth. And also personal care products, which we have put on the body, obviously. PCBs, PFCs using non-stick coatings, right? How many of you are still using non-stick cookware? You can say me in the chat. Anybody here using still non-stick cookware? Oh, I thought nobody will say yes, but there are quite a few, it seems. Okay. So if you guys are still using it, please, one thing you may take away from from this workshop is to throw them away. Don't give it to your maid and all, okay? Don't give poison to anybody else. They're highly toxic. It doesn't matter what the marketing campaigns are telling you, what the advertisements are telling you, they're highly toxic to your body, okay? And the last thing is fluoride and SLS. SLS is found in almost all toothpaste, your shampoos, and other self-care products. It is highly toxic. You can just Google SLS, sodium laureth sulfate, and check the symptoms caused by this. You'll be surprised. And we're putting all of this into our body on a daily basis. And then we expect to be healthy. I'm sorry, such things don't happen in this world, right? And then there is another category of toxins which is increasing rapidly in our environment, and the scientific and the medical community has not understood the impact this is having on our health, which is heavy metals like mercury, lead, cadmium, aluminium, arsenic, etc. Right? Because of industrial activity, they are just everywhere. Okay, they are impact. They are in our agricultural soil. They're in the water. They're in the groundwater. They're in the air. So therefore, they have become highly concentrated, and they can enter the body in any way through ingestion, through food or water, through inhalation, through skin contact, and the damage is extensive, extensive damage. Okay, they create severe inflammation in the arteries and different parts of the body, including brain, nervous system inflammation. Okay, they always create disturbance in terms of how the immune system is functioning, and are often responsible for autoimmunity also. They damage your neurons, mercury damaging microtubules. So in fact, I will share a link of a small video, short video that you can see. In this, they're showing the one neuron under a microscope, and the neuron is growing, okay, rapidly. It grows very rapidly. Very tiny amount of mercury they introduce into the petri dish, and immediately the neuron starts dying. Okay, so severe toxicity happens to the brain tissues. Mitochondria. So mitochondria, we've all learned in our high school biology that they are the energy factories of the cell. That's yes, that they do that obviously, but they have thousands of other functions in the body, including they work very closely with the immune system. And if your mitochondria are damaged, your immune system cannot function properly. Okay, so you will have poor mitochondrial function, which will leave you with less energy, and you will you'll always be tired and aches and pains, and you'll not be able to think clearly, and your immune system is haywire. And these toxins can damage any organ of the body. Okay, they can lead to kidney damage, they can lead to heart damage. I remember reading a study where they said people who are dying with congestive heart failure, basically heart attacks, right? Some 22,000 times more antimony is found in the heart of such people compared to other people who don't have heart disease. 22,000 times more. We need to understand these factors and address them, right? So how do we do that? There are testing that we do. This is a hair test in which we can actually check what is the heavy metal burden on the body. And as you can see here, barium, aluminium, cadmium, lead are very, very high for this person. So we test for heavy metals both in blood and when needed in the hair tissue as well. And then we do the required treatment to ensure that these get they are thrown out of the body. Detoxification is done. As a matter of fact, I'm also spending quite a bit of time talking about this and explaining this dynamic to other doctors and practitioners, because even in the functional medicine community, we don't find too many people realizing the importance and the prevalence of heavy metal toxicity. The next thing is chronic infections. Okay, very, very important category. Chronic infections can be parasites, See, I'm so sure most of you have children, and you know, on a regular basis, 2 or 3 times in a year, you keep doing deworming for these children, right? We grow up into adults and we think all parasites are gone. Where did they go? Every few months you have to do deworming for the children because they keep coming back. Why will they not come back when you're grown up? It's just that the symptoms are different. You're not able to understand or make a connection, realize that they're there, but they're there for most of us, okay, in some level, and they create a big havoc, okay. Now, in our gut, there are trillions of microorganisms, bacteria and fungus. Okay, most of them are friendly varieties. Even Candida is a common thing. It doesn't cause a problem until it overgrows. When it overgrows, it creates havoc. Okay, and the havoc is not limited to your digestive system. Don't think that the symptoms have to show up in the digestive system. They will show up anywhere and everywhere in the body. Okay, anywhere and everywhere in the body. Viral infections are very common. Now, again, don't think in terms of a viral infection like you get viral fever and all. Okay, we are not talking about an acute infection. This is a chronic infection where the virus population in the body has increased, and the immune system is trying to fight and reduce it, but it is not able to get rid of the virus. Okay, this is a chronic overload. And when the immune system is always fighting like this, it goes into a mode where it is unable to distinguish between the body and these microorganisms. It starts attacking the body. Also, sometimes these virus and all, they will hide in some parts of the body. So if they hide in the thyroid gland, for example, your immune system knows they're hiding there. It will attack the thyroid gland. And then you have autoimmune hypothyroidism, known as Hashimoto's, right? So a lot of such connections are there. Lyme disease, another kind of infectious dynamic. Clostridia is a common overgrowth that we see. So we test for all of these, by the way, okay? And we treat our clients for these when we see the overgrowths. Poor liver health. Now, how is liver connected with autoimmunity, right? You might be wondering. Well, you know what? There is hardly any disease, chronic disease in the body with which liver is not connected. It is such an important organ in the body and definitely connected with immune system health. Now, we are talking about toxins of different types: bacterial toxins, parasitic toxins, heavy metals, environmental toxins. Which organ is supposed to get rid of these from the body? It is the liver, right? And if the liver health is not good, which is the case for a majority of people today, okay? Almost 70-75% of the people in urban India have some or the other level of fatty liver disease or other issues of the liver, okay? So it is not able to get rid of these toxins. When it is not able to get rid of toxins, they accumulate in the body. When toxins will accumulate, what will your immune system do? See, anything that is harmful, immune system will try to attack it, right? And if it is always there, it will go on attacking all the time. When that happens, the immune system gets kind of locked in a state where it is unable to turn itself off. And then it will end up attacking the body also, right? So liver, again, if it is producing the right kind of bile, it will be able to maintain the pH of the intestines. If that is done, then intestinal health will be good. Bacterial overgrowth will not happen in the intestines because it's also a powerful antimicrobial. So you see, you connect back to that overgrowth of fungus and bacteria, etc., in the gut. So liver is also playing a big role in controlling that. Bile salts also work like hormones. Okay, they have many functions. Poor gut health, digestive system. Okay, which part of your body hosts or houses the bulk of your immune system? Anybody, any idea? Don't say blood. Any idea which part of the body, which organ? Vanshika is saying ileum, small intestine, and Prashant is saying intestine, Shani is saying gut. Okay, nice, right, very nice. So 70% of your immune system is found in the lining of your intestine. And the lining is just the thickness of one cell. Okay, it cannot be any thinner, basically. So if the health of your intestines is not good, Can your immune system be balanced and healthy? Not possible, right? So when the microbial population, fungal population in the gut is out of balance, your immune system will go off balance. There is no other way, right? When these guys increase in numbers, that is an infection, right? When there is overgrowth of bacteria, fungus, we say you have an infection. Low stomach acid. Oh, this is an interesting one. How many of you have had hyperacidity symptoms, acid reflux, etc., and you have been told you like chest, heartburn, etc., and you've been told you have too much stomach acid, and you've been given antacids? Can you reply with a me in the chat? I'm sure out of 90 of you, there'll be at least 20, 25 such people. Yes? Well, I lost count already. There's so many of you replying. Let me, tell you something very interesting. Hyperacidity, acid reflux, heartburn is almost never caused by too much acid in the stomach. It may be caused by less acid. Okay, it may be caused because the valve between the food pipe, the esophagus, and the stomach is not closing properly. It may be caused because the body, the immune system has become sensitive to some foods that you're consuming regularly. It may be caused because there are bacterial fungal overgrowth in the stomach. It is almost never caused by too much acid. Okay, and antacids, they help you temporarily. Obviously, that heartburn and all is happening, which is very difficult, very painful, and it solves that. So you think, whoa, I had too much acid. No, you did not have too much acid. You had too little acid, but it was in the wrong place. It's not supposed to be in the esophagus because esophagus has no protection from acid, while your stomach does. Okay. Why has nature produced such strong acid? It is strong enough to dissolve iron, okay, if given enough time. Why has nature given so much strong acid? Do you think nature is stupid and we are intelligent? No, isn't it? Your creator is the most intelligent. So it is needed to break down your food so that it can be absorbed. When you bring down the acidity by taking antacids, what are you doing? You are ensuring that you cannot digest your food properly. When you don't digest your food properly, what will happen? It will stay in your intestines and rot and decay, right? Because at that temperature, at the body temperature, it's like peak summer temperature inside the body always, 12 months of the year. Food will rot and decay much faster because it's also, there are trillions of bacteria and fungus present. See, decaying means what? Heavy bacterial action, right? Bacteria are eating the food and multiplying. And when they do that, they produce toxins. All of that is happening in your body when you push down your stomach acid. You see how this process that I'm talking about can be connected with any health issue. It doesn't matter. Some heart attack can be connected with this. Cancers can be connected with this. Okay. Neurodegenerative disorders, Parkinson's and all with this process. That is how important it is to have strong stomach acid. But your treatment, your doctors are pushing it down. They're killing it, literally. And you expect to be healthy. I'm sorry, such things don't happen in this world. I'm sorry if I'm sounding a little brutal, but this is the truth. How else to say it? Right? Stomach acid is the foundation of good health. If you don't have good stomach acid, you cannot be healthy. You cannot be strong. Not possible. Low digestive enzymes. See, for digestive enzymes to be secreted by your body, there are many triggers. There's stimulus which tells the body to secrete. Chewing is one stimulus, but another very important stimulus is the stomach acid itself. When the stomach acid is weak or small in quantity, digestive enzymes will also not be secreted properly. How the hell will digestion happen? It won't happen, right? That is what we are doing to ourselves. Okay, so interesting. So Vanshika is saying, but by not suppressing the acid will cause cancer of the esophagus. Well, Anshika, it will cause cancer. It can cause cancer of the esophagus only if you do not fix the other reasons which I mentioned. I mentioned a list of reasons which cause acid reflux into the esophagus, right? I'm not saying that you stop taking antacids and don't do anything else, right? We have worked with people who had not been able to lie down flat on their bed and sleep for months. Okay, that was a level of acid reflux. The wall was not functioning at all, and we have been able to bring them back to normal. You can go on our Google review page and read. Okay, they have left reviews. This is a person called Vidya. She was living in the US. Okay, so this is definitely treatable if you address the root causes why this is happening. You address those reasons, right? So I'm not saying you leave it like that without doing anything else, but I'm saying suppressing the stomach acid will have major consequences in the long run. Leaky gut, constipation. See, toxins leave the body through your stool, right? Your stool is mainly made up of the bacterial debris and the toxins which the body is pushing out through the large intestine. If you are even mildly constipated, reabsorption of toxins will happen, right? So you are essentially retoxifying the body. And we have seen how toxins impact the health, right? Leaky gut, molecular mimicry, food sensitivities, all of these contribute to autoimmune process. Very, very fundamental. Leaky gut, when the bacteria and fungus increase in the gut and the immune system attacks them from this side, right? Bacteria are here, immune system is here, it's attacking, there's a war happening. Naturally, the gut lining will get damaged. So that is called a leaky gut. And when undigested food particles start entering the body, many of them the immune system will start attacking them because they're not supposed to be there, right? They're strangers for the immune system. And when the immune system starts attacking, what happens is the molecular structure of some of these food particles can resemble something in your body. Immune system will start attacking that part of your body also. That is molecular mimicry. Food sensitivity, I'm sure all of you already know, right? So this is the example of a leaky gut or versus a normal gut. Normal gut, between two cells, there is no gap. This is called tight junction. Leaky gut means the cells have become, damaged and the tight junction is no longer tight, it has become loose. Now, stuff can enter the bloodstream directly from here without any control, right? Now, very, very importantly, I said this earlier, that issues happening in the gut need not show up as symptoms of the gut. Very, very important. So what symptoms will show up? I'm just giving you some example, not the complete list. Headaches, migraines, brain fog, inability to focus, remember, concentrate, eczema, psoriasis, acne breakouts, strong fatigue, low energy, low stamina, depression, anxiety, mood swings, panic attacks, weight gain, inability to lose your weight, PND, post-nasal drip, sinus congestion all the time, 8 months in the year, you have a running nose, achy joints, arthritis, tight muscles or muscle pain, body pain, even fibromyalgia. Okay, it is connected fundamentally to your leaky gut. Canker sores, heart racing, palpitations, shortness of breath, and also GI symptoms like GI pain, nausea, GERD, etc. Okay. And I'm telling you, the list is much longer than this. How many of you have one or more of these symptoms? Or let's say at least two of these symptoms. Can you reply in the chat with a me? Well, you see, there you go. Without gut issues, very, very difficult to develop autoimmunity, by the way. Okay, very difficult. And no, I'm sure nobody has told you this, right? I'm sure you're going to doctors, different types of, medicines you have been taking. Nobody's telling you these connections. I mean, you may want to ask why, but that's out beyond the scope of this workshop. But I want you to understand that nobody is telling you all this, right? And then our modern lifestyle problem of too much of EMF, electromagnetic fields. These are unnatural, okay? And our body is a very sensitive instrument. It's not just physical, it is also energetic. It responds to the energy fields around us. Very, very sensitive instrument. And all of these EMF fields that we have right now, the laptop that I'm sitting in front of me, there's a light in front of me, there's a light behind, there's a fan, there's a phone, there's a charger, right? Everything has an electronic field, and the electronic instruments have much more powerful fields. They're all impacting your body and messing up your health, your Wi-Fi, your Bluetooth, etc. Right? We can't get rid of these things completely, but there are many things that can be done to minimize the damage that they're doing to us. And then poor mitochondrial function. Very complex and vast topic, understanding how mitochondria function and how it impacts immune system function. So I won't go into too much detail. Just understand and remember that autoimmunity in many fundamental ways is primarily mitochondrial dysfunction. Okay, that is how important mitochondrial health is for autoimmunity. What are the factors that impact mitochondrial function? Things like infections, toxins, blue light, right? So the white light, the tube lights emit blue light. Your laptop and your mobile screens emit blue light. Bad quality water, deficiency of nutrients like B complex, vitamins, carnitine, CoQ10, lipoic acid, etc., and many other factors impact mitochondrial health and they damage it. Once mitochondria are damaged, immune system dysfunction is natural. And then dehydration. Okay, you may be drinking 2-3 liters of water, but your body, your cells can still be dehydrated because you're not drinking the right kind of water. Okay. So when I'm talking about right kind of water, what I'm talking about is a difference between structured and unstructured water. Okay. So chronic dehydration, again, just a small list, it's actually much longer, has been linked with all of these and more diseases. And again, I'm sure if I ask you how many of you have at least one of this, many of you will say yes. And last but not the least, I mean, this is in fact the big elephant in the room that nobody is willing to acknowledge or accept, is chronic stress. We've become so used to chronic stress that we don't even realize we are stressed. Okay, forget about doing something about it. What I want you to understand is the moment there is the smallest amount of stress in your mind, the nervous system will change how the body is functioning, and it will move the focus of the body away from healing and reproduction and metabolism and excretion and detoxification, all the processes which are important for maintaining good health. It is not interested. Your nervous system is not interested. Why is it not interested? Because the moment you create stress in your mind, your nervous system only thinks that some animal is trying to kill you and eat you up. That is the only thing it understands when you create stress. Today, in the modern, so-called civilized world, we may get stressed because of a million reasons, because you have a stressful job, your boss shouted at you, your mother-in-law is angry with you, or you are driving on the road and somebody just cut across you and you're fuming now, right? It could be any number of reasons which have nothing to do with your life being in danger, but your nervous system thinks your life is in danger. When your life is in danger, then it activates the fight or flight response, right? It wants to enable the body to run harder or faster or fight harder and survive. Is that the time when the nervous system should focus the body's energy on healing and rejuvenation and reproduction and metabolism? It's a waste of energy. You will reduce your chances of survival, right, in the wild if you do that. So it is doing the right thing, actually. But then if that is happening all the time, then your health will go for a toss naturally, right? And just the last slide before I hand over the session to Dr. Ruhi again. This is just to show you that every organ of your body, whether it is your eye or your trachea or your heart or your liver or your digestive system, every single organ of the body is connected with these two parts of your nervous system. They're not really parts, but they're functions, right? Sympathetic, which is about stress, fight or flight response, and parasympathetic, which is about rest and relaxation and healing. And how your body functions when these two are dominant is different. Every organ has receptors for both of these, and the function and the behavior of the organs changes completely. Okay. So with that, I will stop sharing my screen and hand over the session to Dr. Ruhi. Thank you for listening to me.
Okay. So how many of you could connect to at least one of the root causes which Siddarth has shared? At least one of the root causes, could anybody connect? If you can let me know in the chat, do you think any of those root causes played a role?
Maybe you can also mention which one is applicable for you.
Okay, so I see some of you are saying toxins, diet. Okay, so at least you could connect some of the dot that, in your case, autoimmunity just did not come all of a sudden. Something that you know is happening to your body, is there in your body, has contributed to the problem. So now if we have to treat, if we have to fix autoimmunity, can just painkillers or immunosuppressants, can they be just enough to treat autoimmunity? None of these are actually addressing the root cause, why you have autoimmunity. So the bottom line is, if we really want to fix autoimmunity, you will need to change your approach. You will have to move away from just managing symptoms to actually go to why the symptoms are there in the first place. Many times, I'm sure many of you would have also experienced it, that, you are struggling with a lot of symptoms, like many of the symptoms that you can see right now on the screen. You have a couple of these symptoms, but then you don't have a diagnosis. Your reports are kind of normal, but again, I'll come to that point. So there is no diagnosis, but you have these symptoms. Has anybody experienced this? That you have symptoms, but yeah, your reports are not really revealing anything. Maybe you're looking for a specific autoimmune marker and it's just not coming positive. And because it's not coming positive, you're not able to start any treatment. So if we keep chasing a diagnosis, we will just be losing time. If you are experiencing at least 5 of the symptoms, that I won't even say 5, even if 3 of the symptoms are there, that on the screen right now, your body is just trying to say something is wrong and you need to do something about it. It's a sign of inflammation in your body. And chronic inflammation is what eventually contributes to chronic ailments and autoimmunity, metabolic dysfunction. All these are a result of chronic inflammation, which was just not addressed over a period of time. So instead of trying to really look for one specific marker so that you can be tagged with a disease, please change your approach. Look at why really you have fallen sick. What is the uh, triggering factor for your fatigue? What is the contributing factor for your chronic insomnia? Why are you getting skin rashes all the time? You don't really have to get a diagnosis of lupus or urticaria or anything. You just need to take a step back and look for the contributing factors. So we have to stop treating each symptom. Our body is, it works as a very complex symptom. So if we just keep chasing one symptom, trying to, manage each symptom, you will end up taking 10, 20 pills. So we have to stop treating each symptom separately, and just taking a pill for every symptom is not the solution. You will have to look at the body as a whole. So that means you have to take a step back and look from the lens where you're really looking for finding the root causes. So now we know 10 root causes, right? There can be more, but these are the most common contributing root causes to autoimmunity. Now, if we have to fix it, trust me, it's not so difficult. You just have to do the right things in a structured way. The first is you have to maximize what your body needs. Your body needs all the raw material. Your body needs the right condition. What does this include? So the first is, during all this process of repair and regeneration, it needs a lot of raw material. Just like you want to prepare a certain cuisine, if you don't have if you do not have even one raw material, one of the spice, your dish will not turn out good. The same is with our body. If the body has to make a hormone, if the body has to make, for example, the thyroid hormone, and you do not have enough proteins, it will not be able to make it. So similarly, there's so many physiological processes. So you need enough raw material for your body to carry on its routine physiological processes. And these are good quality air, structured water, all vitamins, minerals, antioxidants, protein, healthy fats. If you are not giving any one of them, you are disrupting the normal process of the body. And it's not just about the raw material. You also need to have that belief that you can recover yourself. If you're just giving all everything to your body mechanically, without having a positive mindset, recovery is difficult. What you really need to remove from the body is all kind of things that's harmful for your body. This includes all kind of toxins. You have to reduce your exposure to the toxins. You have to reduce your exposure to the infections, allergens, and at the same time work on removing what is already there in your body. You cannot run away completely from stress, but definitely you can have very good stress management techniques in place which will help you cope up with your daily stress. If there has been an emotional trauma in the past, you need to work on it, because otherwise it will be like a roadblock in your recovery. And of course, you'll have to remove all limiting beliefs that you cannot recover. It's very important that all these kind of negative expectations, fear are out of from your body. And above all, we need to prioritize, give our body the right kind of environment which is conducive for recovery. And this includes, you need to have all the sleep hygiene in place so that you can sleep, rest better. You need to have an environment which kind of, allow you to be happy, allow you to laugh often, reduce your stress, work on various mechanisms related to that. Very important is the right kind of exercise. Many times, people run after burning calories or doing exercises because exercise is very important. When you have high inflammation, too much of exercises are counterproductive. So it's very important that you choose the right kind of exercise, stretch your body enough, focus on your breathing, have good breathing mechanisms in place. We spoke about toxins, removing toxins from life. So the same is with relationships. Toxic relationships have to be out. You will have to choose what kind of relationships you want to keep and which ones you have to let go, because they are also a roadblock to the recovery process. And again, I would want to stress, positive visualization is very important. You may be doing everything, but then if you do not have that positive belief and if you do not visualize yourself in the state where you want to be, there is something missing in the entire process. So imagine, you need to imagine yourself in a state where you want to be. Now, if we have to do all these things, definitely we need a proper structure in place. With a functional medicine approach, which is a root cause based whole body approach, that's exactly how it helps in achieving all these things in a systematic way. So it's not about looking at the symptoms alone, but looking at symptoms in the entire body and then treating the whole body. So if someone comes with rheumatoid arthritis as a diagnosis, I cannot just go and start fixing what is happening to the joint. It's a very narrow approach. I have to look at the whole body. And when we look at the whole body, you will see that person has gut health issues. That person has not been sleeping well. The person has been chronically stressed. You look at the heavy metal markers, they are skyrocket. Deficiencies are very high. So it has to be a holistic approach. So what you see on the screen right now, so in functional medicine, we look at all the stress factors, the gut health, the emotional factors. We work on the detoxification pathways, on the physical activity, on your mental health, use certain nutraceuticals to address them, work on providing the body the right environment for sleep and rest, help you with certain mechanisms so that you can work on past trauma, you can work on improving relationships, and of course diet is a very important aspect of the entire process. So these are the root causes that we address: the toxins, the heavy metals, the chronic infections, because if you do not treat chronic infections over a period of time, they just become a part of your cell. So, and the immune system is trying to fight or attack that pathogen, but because it is so tightly now a part of your cell, the immune system ends up damaging its own cells. Deficiencies, of course, inflammation has to be addressed, the gut has to be fixed, the engine of the cell, the mitochondria, that has to be brought back into function. Detoxification pathways have to be addressed. Your stress coping skills have to be improved. Of course, we are so much surrounded by non-native EMF, so we need to have strategies in place to work on those things. And 80 to 85% of our body is water. So we need to hydrate our body with the right kind of water. So when we do all these, we can definitely expect our body to recover. We can start seeing ourselves moving in a positive direction. Now, how do we do all these? So what we have put together is a 3 months comprehensive program, which starts with a detailed history taking. So in this, we take in all the details about your sign and symptoms, of your current sign and symptoms, about the history, how you have developed the condition, your past history about any other conditions, surgeries that you may have. Take your current nutritional habits through the nutrition questionnaire. Based on the data you've provided us, we recommend you certain tests that will help us address the root causes. And these are a combination, again, depending on what sign and symptoms you provide us. The blood tests are very detailed. It covers all the nutritional markers, inflammatory markers, organ function, heavy metals, metabolic dysfunction markers. In most cases, the gut health is also compromised. So we do recommend a test which is a kit-based test, and it helps us with the metabolic function, the gut infection markers, mitochondrial function, certain nutritional markers also. And in cases where required, where of course we are testing the heavy metals in the blood, but in certain cases we also have to do a tissue analysis for heavy metals, which is a hair sample analysis. Now, once we have all the data, all the signs and symptoms, all the test reports, we analyze them and to identify the root causes at play in that individual. And then based on the root causes, we make a personalized nutrition plan. Anything that you eat should only help in healing your body. So that's where the personalized nutrition helps. And then there is a treatment plan, which includes all the lifestyle recommendations and the supplement plan. Once you receive your treatment plan, the first consultation happens, which will help you, where we will help you explain why, what's the root causes, and then how we are going to address it. And the second consultation is for a follow-up during the course of 3 months, where we see how you're progressing, any iterations needs to be done. Now, we just don't want to give you a treatment plan and be done with it. We strongly believe that once a person is empowered, they will be able to sustain the changes for their lifetime. And that's what you need if you really want to address a condition like autoimmunity. So we have interactive sessions during the course of 3 months. Some of these are live sessions, some of these are recorded sessions, and all these sessions are on different topics. They are either taken by me or Siddarth. And in these sessions, we have covered aspects which is very important in the recovery. So, because only when you understand why this is important, why the gut health is important, how does it, affect your body, what kind we talk in detail about the nutrition, we talk in detail about the mitochondrial non-native EMF. So that's what covers all these sessions. We advise you on the kind of meditation you can do and the stress management techniques that you can have in place, the right kind of physical activity, the kind of yoga practices that you can do. Now, detox is a buzzword, right? But it's not a good idea to do detox just do a detox. That will not yield results. Detox has to be done in a very careful way. It has to be done at the right time during a recovery process, because the body has to be prepared for detox. Your body should be able to handle the detox reactions, the die-off reactions. So we have a 3-day guided detox process, and we plan it in the second month of the program, because by the first month, your body has prepared itself enough to allow the detoxification to happen. So, and it's a beautiful process of detox that we do, and our participants have shown wonderful results. They have shared wonderful experiences after this. And of course, with all these, there is WhatsApp support during the course of 3 months. Because you have to change your food habits, etc. You will need recipes, you will need shopping guides, you will need various hands out on various aspects. So we provide all these so that you can, it makes the implementation process easier and convenient for you. Now, as you start implementing these things, you can see that your body is recovering, your body is healing. And these are just the few signs of healing. There are a lot more. You will see your energy levels going high. You will not be tired when you wake up in the morning. If you have had headaches, you will start seeing a decrease in the frequency of headache, the severity of headaches, and eventually they will be eliminated. Your sleep will be good. Your period flow would be better. There have been cases who had come to us who had menopause at the age of 38. They were able to have their regular periods again by addressing what is wrong in the body. You'll see an improvement in your skin quality. You'll see an improvement in your hair quality. You will feel in sync with your body. You will no longer be dragging your body. Cravings will be less. You will be less bloated. Your gut, your bowel movements will be regular. And very importantly, when you wake up in the morning, you will not be all inflamed and puffy. So these are just a few signs. Now, so that's the functional medicine program. And so it's for 3 months. The program cost is 16,000. So that covers everything that I just spoke in the previous slide. What it does not include is the cost of test and the supplements. Now, this program is specifically for women. We have a separate program for men, where the structure would be pretty much similar, except 1 or 2 changes. Now that's what we had to share. And before we open for Q&A, we would want to share a testimonial from one of our program participants who had multiple autoimmune conditions. She had 4 autoimmune conditions.
Hello all, this is Aparna from Hyderabad. Few months back I've been diagnosed with MCTD, which is called multiple connective tissue disorder. It's an autoimmune condition where multiple autoimmune disorders have been attacking my immune system. At the same time, I had RA, rheumatoid arthritis, then I had Jordan syndrome, which had affected my eyes, and I had many other conditions also. I mean, my symptoms were I used to wake up with pain, and especially in my left wrist and my thumb joints. I used to wake up with pain every day in the morning, and my eyesight started to, become very blurry. And then I used to have this brain fog, very, very, very lethargic and no mood to do anything, or low in energy all the time. But one day I came across Hormone Research over Instagram and I contacted them. I took over the plan, very sustainable plan. I could make over the changes. I think within almost 3 weeks, I was able to adapt to the plan very easily. And very good supplements which started to show impact very quickly. My hair fall started to reduce. My acne marks have gone. My skin started to feel much better, and then I started to have a burst of energy all throughout the day. And today, especially today, now being the monsoon season, I can wake up without pain. I mean, very, very mild and very little pain in the smaller joints that I have, but otherwise I feel very, very good and happy after taking the plan from Hormone Research.
So, okay, we will open up for the Q&A.
And we'll also launch a poll. It's just one question, and we request all of you to please answer this while the question answer session is happening.
So we will allow like 30 seconds or a minute to just allow you all to answer the poll before we start with the Q&A. So I hope all of you are able to see the poll on your screen.
And those of you who want to ask questions, you can raise your hand. So the team will, call your name in the same.
Tanya, you can unmute yourself and ask your question. Tanya, are you there? Okay. Muhammad Abdul, are you there?
Hello.
Okay, both of you have unmuted, so we'll allow Tanya to ask. Tanya, please go ahead.
Ma'am, is deformity reversible in case of rheumatoid arthritis?
How severe is the deformity, Tanya?
Ma'am, it's just 20 days old and I have had developed it in the past also. But that time I started taking allopathic medicine and doctor said that miraculously, your deformity got, reversed, but it wasn't possible.
And
So right
what
now I'm off medications.
exactly do you have now? Where do you have the deformity? In your fingers?
In the elbows, in both my elbows, they are bent inwards. I'm unable to straighten them up completely.
Okay. See, as we again, we'll have to see how severe is that deformity, but definitely as we bring down the inflammation, right, in that area, improvement to some extent is definitely possible.
Okay, ma'am.
And it can also be complete again, depending on, how severe the condition is, how much damage has happened.
Okay, ma'am. Thank you.
Okay. Mohammad Abdul, are you there?
Hello.
Yes.
Yeah, I'm there. So my question is regarding the autoimmune conditions. So I and my sister have the autoimmune conditions. I have ulcerative colitis, and my sister has LPP. Uh, and she also suffers from digestive issues. And my mother also suffers from digestive issues. So my basic concern was, along with the digestive issues, my mother also has a stricture urethra. So is that condition related to autoimmunity? She suffers a lot. She's been suffering with that since last 6 to 7 years, and it's frustrating for all our,
Yeah.
family members
So,
too.
right. So see, what is basically in structural urethra, chronic inflammation has led to that condition. Okay. Now
Mhm.
there was inflammation, constant inflammation in the body. Nothing was done to address it, and that eventually kind of became chronic and has resulted in a condition like this. So with what we can do is definitely halt the progression so that further damage does not happen. Okay. That is definitely we can achieve in your mother's case. Okay. And it's also possible to have a good recovery also, depending on how the body responds. Okay. And now you also need to understand that, one thing that is currently she's experienced is it's affecting her urethra, but the inflammation is so high that it can affect other organs also.
Yeah.
So, I mean, we can definitely help her, improve her current situation is definitely possible. And with yourself and your sister, right? I mean, they're
Yeah.
good improvements, very good improvements are possible.
Okay. All right.
Shrujana, are you there?
Yeah, hello, ma'am.
Yes.
Yeah, so I'm suffering with IgA nephropathy for kidney. So right now, my creatinine is 9. So how it is dealt and how it is cured?
So, were you there during the workshop from
Yes,
the
I
beginning?
am there. I
Okay.
heard. Yeah,
Yeah. So you've heard all
yeah,
the causes, and so again, I'll just be repeating myself if I explain again. So those are the root causes. So and when I explain the program structure, so we will be looking at the contributing factors in your case, and identify the root causes, address them with a holistic approach. And we have worked with patients of IgA nephropathy, and their kidney function has improved a lot over a period of time.
yeah. So it is cured completely.
So when you say cured completely, okay, understand this. A problem has come in your body because of certain reasons. Okay. You need to work on identifying those reasons, remove them from your body, and also give your body the right condition, not just for that period of time, but for life. Okay. So
Okay.
if you work with us, definitely 3 months, 6 months, 9 months, we will make you healthy. But after that, you will have to continue giving your body the right condition.
Okay. So I have one more query. Suppose if I'm taking vitamin D 60K, how
Hmm.
much vitamin K2 should be taken?
So now again, in a session like this, we do not recommend on any supplement dosing.
Okay. It's a generic question. Like suppose if I am taking 60K vitamin D,
It's
how much?
better you don't take it separately. There are good brands which uh, from which you can get a vitamin D plus K2 supplement. Okay, it's better to go for something like that.
Okay.
Yeah.
Okay. Okay. So, but yeah, fine. Thank you. Thank you, sir.
Okay.
Okay,
Santosh?
yeah, Santosh, are you there?
Yes, I'm there. Yeah, actually, my query is for me and my sister. My sister is actually suffering from rheumatoid arthritis, and I have been suffering from psoriasis. So, coming to rheumatoid arthritis, it's like since like 4 years, there was some deformity in her hand, fingers, and leg fingers. I was looking into that, and for regarding me, I have been suffering from psoriasis like from childhood. So every time the symptoms are coming in winter season, like around November to it comes around up to April, May. So these are the months I get very severe, and the rest of the time the symptoms goes like the skin abrasions like that. So I want to know about these two things for myself and my sister.
So, okay. So, Santosh, what exactly do you want to know? If you have a
Uh,
specific.
No, there is no specific reason. I just listened to this meeting, so I'm planning to join the program, but not immediately, like in coming month. So ja I would like to know if you want, if doctor or anyone to suggest some any changes that we need to take. Like I heard about toxicity, like whatever we are going on in our daily life, right from the food we eat or the environment, anything, and it's very good. Just if I'll just looking for any suggestions or anything from the doctor.
See,
You, ma'am.
suggestions are all personalized, right?
Yeah.
We have spoken a lot about what the basics during the workshop. So if you
Yes.
spend some time listening to it again, you'll be able to understand what changes you should get started with. As far as your question about flaring up of your symptoms in the winter, right?
Yeah.
Now, winter psoriasis, fungal infections play a major role. Okay. Now, in winters, you will see the weather is cold, it's damp, right? There's not enough sun. And that kind of conditions makes the fungus thrive. And that's why you will see a flare up of your symptoms in the winters.
Yeah.
Okay.
I'll connect with in the team.
Okay. Yeah.
So any of you who are interested in more information, that if you want the team to reach out, you can please leave your contact numbers in the chat. Okay.
Yeah,
And
sure.
also shared the link of the WhatsApp group. If you're interested, if you're not part of the group, you can join the group using that link. Yeah, Prashant, are you there? You can unmute yourself and ask your question. Prashant, are you there? I can see you have unmuted, but okay, Parul, can you unmute and ask your question while Prashant is sorting things out, I guess?
Yeah, I just wanted to check. I am allergic to UV rays, so I'm very sensitive the moment I have like a 10-15 minute of exposure to sun. Is that also defined as an autoimmune or?
It is definitely a immune reaction, okay? And this is also very commonly driven by the same fungal overgrowth that Dr. V was just talking about earlier. Very common symptom of this,
Okay.
of fungal overgrowth in the body. Yes. And it
I
is
mean,
definitely the immune system which is attacking the skin, right? All the rashes and all that erupt.
okay. I mean, it never got classified as autoimmune, any doctors that I've seen so far. So I was, it's just that I read that on the website. So I thought I'll just, understand it.
So, Parul, and I guess because of this, you may be definitely avoiding sun all the time.
Yes.
Yeah, but you also need to understand how important sun is for our overall well-being. For our mitochondria only gets charged by sun. And if you are not exposing yourself to sun, you are depriving your body from one major thing. Okay.
Correct.
So you need to work on developing a callus for your body so that it can start tolerating sun. Okay. So, I mean, right now you may not, I don't know if you've got a detailed evaluation done for yourself, but when you do it, you will definitely be able to find markers which are out of balance and indicate inflammation in the system.
Okay. All right. Thanks.
Are you able to hear me now?
Yes.
Yes.
Yeah. First, I would like to compliment your session. I have one question. Although I have joined this session to understand RA and other autoimmune diseases, my daughter suffers from this. She is in US. So I'm little bit not sure, how she would be able to, join this course which you conduct for this kind of conditions. So because doing certain tests and all in US could be a little bit of tricky thing. So
Yeah,
just wanted to understand.
we have patients from all over the world, including many from the US actually.
Okay, okay. So
There
you
are
would be
tests.
able to manage even from there?
Yes, yes. So there are, kit-based tests that can be done wherever they are in the world.
Okay, okay, okay. Wonderful, wonderful. So maybe I would like to know a little bit more what exactly will be done, during this course. Maybe if you have some additional information, if you could share it, then it will be helpful for me to pass on that to my daughter.
We will share a brochure in the chat that you can download and share with her. Okay. And
Okay,
we'll
okay,
also be, if you have joined the WhatsApp group, we will also be sharing the recording of this workshop.
okay.
You
Sure,
can share the
sure.
recording with her as well.
Okay, sure, sure. Thank you so much. Thank you so much.
Yeah, Shrikant, you can unmute and ask your question. I think your question was about LADA diabetes, right?
Yeah, that's right. So for me, what I want to know is, of late in last 4 months' time, my sugars went up, and tried to contain it with medication. And later on, I just did the C-peptide test to see that it was around 0.8, and then went on to the GAD 65 of late last month. So then it came out to my surprise that I was positive for that. So there are a lot of predictions, like it could be from Covishield or it could be from some other toxicity, but unable to.
That has definitely been a precipitating factor for many, many people to, trigger autoimmunity. So it's possible.
Yes. Yeah. So this has really, changed the life as such. The way I'm right now started insulin also in just 4 months' time, from nothing to insulin. So that is
And what's your,
how. Pardon?
what's your age?
I'm 48. So my family, nobody has got any diabetes or any other autoimmune condition or anything. But this has just suddenly come up. So I have just reduced 14 kilos with a good diet and food and everything. And also diabetes, also insulin resistant dependency also contributed to the weight reduction. Trying to increase now, very difficult to increase. And so that's the challenge which I'm having. So I just want to understand, because I've just joined a couple of other courses also, wherein they all are talking about detoxification, yoga, and food control and all, because which I'm already doing. But again, what interests me in this program is that you are trying to find the cause of it to some extent, and then treat and supplement it accordingly, right? So, any experience with any LADA patients as such in your this thing, where it will be of some help to me to understand?
We have worked with quite a few children, type 1 diabetes, and we have also had some success over there.
Okay.
LADA, Dr. Ruhi, have you worked with any LADA patients?
So, okay, let me. So again, it's autoimmune driven, right? Yeah, I'm sorry, what's your name? Prashant, right?
Shrikant.
Shrikant, okay. So Shrikant, it's autoimmune driven. Okay.
Yeah.
Now, the approach to any autoimmune condition is the same. We don't
Okay.
really have to put it in different categories. Okay. We have to understand that there is high chronic inflammation in the body. We have to address that. And then, because see, it's involving your pancreas now, it can involve any other organ, right? So we'll have to address autoimmunity.
Okay.
And as we do that, further damage will definitely halt, okay? And we can get good optimization of the blood sugar levels, of the insulin levels.
So are you saying that, this GAD65 will be reduced when you say that, autoimmune condition will be reversed? It will come down, right? That
See,
should be the
GAD65 basically tells you it's an autoimmune, it's an autoimmune marker, right? And in many cases, there is no quantitative measurement of GAD65. It's more of whether it's negative, it's positive,
correct.
right? So it will, I mean, it will not get negative, okay?
Yeah, correct. Some minimum will be there for everybody. Okay.
Yes, yeah. But you will see improvement in your other inflammatory markers.
Like what?
So inflammatory markers again can be, for example, ESR, if it's high, you will see an improvement in that. Your CRP,
Those two
HSCRP.
means CRP and ESR and all are like pretty normal. So because maybe it just started, maybe that could be the reason.
See, yeah, and of course there are, in many cases, your ANA, ACCP can be high. They are high usually. There can be other autoimmunity markers that are high. Usually we also see that, in patients who have one autoimmune condition, you will also see that thyroid antibodies also high. Okay. So there are various such markers which can also be used as a measurement to see the improvement.
Okay. And this journey has been positive for many, is it? And they have what happened? I mean, their insulin is reduced, or what will be the outcome like?
Yeah, so with type 1 diabetes, what we have been able to achieve is one is definitely the blood sugar levels, despite on insulin, the HbA1c would be very high. So we have been able to optimize, get a good control over the HbA1c. Second is, the insulin requirement has been optimized. So rather than just eating anything or, not giving the body the right condition, just taking n number of insulin. So that we have been able to optimize a lot. And of course, with looking at what the deficiencies are in the body, improving the mitochondrial function by looking at the toxins, infections, all these, right? We're improving the efficiency of the machinery of the body. Okay, so overall the cells are healthy, the body is healthy, so a lot of other symptoms improve.
Okay, so this reversal is not a real possibility, right? It's just controlling and managing, is it?
With type 1 diabetes, this is what we have been able to achieve. With one child, we had been able to help him go off insulin also, but that's not the case with every, that's not achievable in every case.
But the prognosis for Shrikant is probably a little better because the pancreas is still functional. Okay, the other for children, the pancreas were long back, they were completely destroyed, the beta cells, right? So which is not the case for you. So if you start ASAP, I would say you have a much better chance of saving the pancreatic cells, right? And not becoming completely dependent on external insulin. See, the point is this: these things may not be possible or reverse, to reverse in, let's say, 3 months, 4 months, 5 months. It may take much longer, duration of work. But if we are able to curtail the process of autoimmunity, if we are able to bring the immune system back into balance, then if the beta cells are still there, they're not, all of them are not dead, then naturally some regeneration will happen over a period of time.
Correct, got it.
But again, that's not going to be a short time. It will take, its own time. But that is possible for you because there is still functional cells left.
Correct. I just said three insulin is
0.8 means the pancreas still working.
Yeah, 3 is the insulin assay score, and 0.88 is the C-peptide. But that I checked a month back. I don't know, after 1 month again, this GAD has created more havoc. I'm not sure about that.
So yeah, in LADA, the process compared to type 1, the damage process is slow. So the earlier one can intervene, the results would be better.
Sure. So predominantly it is diet and supplements, right? That is what
Diet,
program.
lifestyle also, and supplements, yes.
Okay. Thank you so much.
Okay. All right. Ravinder, you can unmute yourself.
Hi. So I have endometriosis and I've had the second surgery a month back. And along with that, I'm ANA positive, but the lupus is on dormant state. Now, having said that, since I'm 32 right now, since I was in 8th standard, I was having a low platelet count, which is around 80,000, right? So endometriosis is ruled out, that's out of the body now. But the problem here is lupus. I still don't know how to get it done. I have taken H2C, HCQS, I've taken SARS, but then they don't go well with my stomach. Now, having said that, my digestion is very sensitive. Is it related to lupus, or can I say that this digestion issues could be due to leaky gut? Right? This is a very confusing state where I'm in. Now, in terms of diet, I do take gluten-free, dairy-free, soy-free. I make sure I eat homemade meals. I make my own coconut milk, and I make sure everything is being done by my own. So I'm really looking forward to a good functional doctor. But my last experience was something wherein the doctor was not like they promised they can reverse lupus, but then ended up they didn't have much achievement in that.
Okay. So, Ravinder, now good that you are on a healthy, clean diet. So you are able to not feed your system with stresses.
Right.
While you avoid that, it's also important that you fix the body. Okay.
Right.
When I fix the body, leaky gut will definitely be at play. Okay. So you have to fix the leaky gut. You've eliminated what is harmful, but then the damage that's there in the body still has to be fixed. Okay.
Right.
And only once we do that, then the healthy food will also be useful for the body. The body will be able to utilize it.
Right.
Now, with the surgery that you said you've undergone, so you've removed a certain mass, right?
Yes.
A growth in the body.
Right.
So I won't say that the endometriosis is over.
Absolutely.
Right? So you've removed a growth in the body, but the contributing factor is still there.
Right.
Hormonal, the estrogen dominance is still there in the body. So that has to be addressed. And again, endometriosis or uterine fibroids, all that they also have an autoimmune connection. They are connected with high inflammation.
Absolutely.
Okay. So your high ANA, again, which you are connecting to lupus, is also connected to your endometriosis.
Right.
Okay. So again, your digestive system is not great. And when we look into details, there will be other imbalances also in the body.
Right.
So if we work on that, definitely we will be able to also address estrogen dominance, which can kind of otherwise also contribute to new growth in the future. And of course, lupus will also be taken care.
Are we here talking about bioidentical hormones?
So we don't use bioidentical hormones, right? Our focus is more on enabling the body itself to be able to kind of, address the imbalances in the body.
So how are we going to do it for endometriosis? That's my question. Because my last conversation with the functional doctor was pitching in bioidentical, and I think it's the right thing that he told me. I mean, I won't say that he misguided me, but I'm very interested to know. I'm more interested in much natural thing rather than sticking to any type of hormones, so to speak.
So that's what I've been explaining. That's what the entire workshop was about, natural things, right? So bioidentical hormone is an option, but yes, which you can definitely consider. But just going on bioidentical hormone is also not the solution. You are still overlooking the imbalances in the body.
Mm.
Okay, so all those things definitely have to be fixed. Bioidentical hormone can be an add-on to it.
Okay.
And
So have
generally, if
you?
those are fixed properly, you do not need bioidentical hormones most of the time.
So can we like reverse lupus, or is it maybe can put it on pause?
Definitely, yes.
For how long? Because I've seen patients for like when their kidneys are being impacted. It's a very horrendous feedback I've got from other patients.
So
I understand, this is a 3 months program, but I'm looking forward for the more longer approach to it. Like, would there be any after 3 months? Are we supposed to get back to you or something? How it is?
yeah, I'll explain that. So 3 months is the starting journey. Okay. 3 months, you will see your health getting better. You will see your symptoms getting better. But 3 months is not enough to achieve fixing a condition like this. We need at least 6 to 9 months, right? And we only recommend people to work with us at least for 6 to 9 months, get good stability of their health, get the foundation right, get things optimized. After then, you will be able to manage on your own.
Okay. All right. Makes sense. Thank you.
Okay. All right. We'll take quickly 2 more questions.
Anjali Burman has registered for the program. Thank you, Anjali, for doing that, and we look forward to working with you. And also, I think Rupa is asking how to enroll. Rupa, the team has already shared the link in the chat earlier. You can register through that. Yeah.
Yeah, and Sona Mani, I have psoriasis for 10 years. My ESR is raised and lymphocytes is low. Can I go for remission? Yes, that's definitely possible. It's possible that you can go on remission.
So ESR means infection generally, and lymphocyte being low again means a chronic infection where the body's immune system is actually getting depleted. So yes, these things can be addressed, and then once they are addressed, you will definitely feel better.
Okay, Urvi, you have a question?
Yes, I am diagnosed with multiple sclerosis, which is also an autoimmune condition. So I wanted to know the success rate for the functional medicine for multiple sclerosis. And for this, I had a symptom with my vision. Like after every 5 years, I have been a problem with my vision. And last June, third time I had this problem. So I am started with the immunosuppressive medicines this time since 6 months. So I wanted to opt for functional medicine. So wanted to know how it can help me.
So Urvi, we have worked with MS patients and we have seen very good improvements in them. Okay. One is, of course, with MS comes also a lot of symptoms which make daily life difficult. Okay. That definitely is taken care along with halting the progression of the condition.
Okay. And also, as I think earlier also somebody asked, like after 3 months, what is the after support? Like already I've started with the medicines and how I don't know the progress rate. Like after the steroids for 15 days course, I get my vision back. But with this program, how do I identify that it's, getting better, and how will I know the change after 3 months?
So when you come to us, we will capture all your current sign and symptoms. Okay. Now, see, our body is very expressive. Okay.
Okay.
If you listen to your body, you will, and once you start implementing the plan, you will be able to see how your body is responding to the treatment that would be recommended to you and how your symptoms are improving. Right?
Okay.
I'm sure you will have a whole lot of symptoms when you come to us. And over a period of time, when our team does the follow-up, you will be able to see which symptoms have improved, or let's say which symptoms do not have any improvement. So you will definitely be able to do that assessment.
Okay. Yeah. Thank you.
Okay. Okay, we'll take one last question, Roshni. Okay. So Brinda has sent me a message. I'm in Chennai. In case I enroll for the program, how do you handhold us through the program? And is everything online? Do you have a base in Chennai? So Brinda, we don't have a base in Chennai. We are based in Bangalore, and our entire program is delivered online. So right from the consultations, the history taking, everything is done online. And as far as the testings are concerned, we do have partners who facilitate home testing. So again, you don't have to go anywhere to give a blood sample or anything. So, and you're just in Chennai. We work with clients around the globe. So that's not really a challenge at all.
Can you please elaborate on structured water you were talking about?
Okay, so I'll quickly do that. Siddarth, you want to go ahead?
Sure. See, Roshni, the simplest example of structured versus unstructured is coal or graphite versus diamond, right? Both are 100% carbon. The only difference is how the molecules are arranged, right? And you see how different the properties become. You cannot imagine it's the same material, right? So same way for water also. So this is something we have studied in our, high school or 11th, 12th, physics, fluid mechanics, that water molecules have amongst the highest forces of cohesion and also adhesion, both, which is a very unique property in water molecules. So they tend to stick to each other and make big clusters. 50, 60 molecules can stick and make a big ball. Okay. Now, if you drink this water, you may drink enough water, 2 liters, 3 liters, or whatever, right? But this water will not be able to enter your cells because the pores in your cell membranes are very tiny and these big clusters cannot pass through. Okay, so your cells will still remain dehydrated. Structured water is where only 5 or 6 molecules are sticking to each other, so they're making a very small cluster. This is called structured water. Chemically, the thing is same, it is H2O, right? But in terms of biologically, how that water behaves in your body is very, very different. So that's what I mean by structured water.
Okay, thank you so much.
Okay. Okay, Tanya, can you repeat about blood testing? Tanya, you may want to see the recording. We will wrap up for now, but it will be a very detailed testing covering all organ function, tests, toxins, inflammatory markers, deficiencies, etc.
And the other important thing is that you don't have to go anywhere. Our partners will do home pickup. They will come to your home and they will take the sample and go. So Sneha has also registered for the program. Wonderful, Sneha. Thank you. And we look forward to helping you recover your health. I hope everybody here has answered the poll. And thank you very much for all of you being here. And, till now, almost 35 of you are here.
Hello, ma'am. Hello.
Yes, Sonamani.
I have some question to you. Actually, I was 13 years old in 2013. I had repeated strep throat for 3 months. And after 3 months, I have psoriasis. My psoriasis is come. Doctor told me for tonsillectomy, but I had not done. My ASO titer and CRP was raised on that time, but my psoriasis is not recover. It's come repeatedly. Gutted psoriasis. Okay. So, will it be cured in your program? With your program?
Okay, Sonamani, आपने वर्कशॉप अटेंड किया पूरा?
या किया।
अगर आपने किया होगा तो आंसर आपने सुना होगा, हमने और भी काफी क्वेश्चंस आंसर किए हैं.
Not psoriasis. Psoriasis will it be cured?
No, definitely. There was a question someone had asked, जिनका winters में बहुत flare up होता था psoriasis. So yes, psoriasis, it's an autoimmune condition again. and इसमें fungal infection is one of the major root cause. तो बिल्कुल
Fungal.
yes, so बिल्कुल ठीक हो सकते हैं.
Okay. 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 I will call you. Okay. Okay.
ठीक है. Okay. Yeah, thank you everyone. Thank you for being a part of the workshop. And if you have not joined our WhatsApp group yet, Tanisha has shared the WhatsApp link. You can join the group. If you have any questions, you can reach out to Vanita. She has shared her WhatsApp link and her number, so you can connect with her, get your queries addressed. And yeah, so we look forward to helping those who want to be a part of the program. So our next program is starting this Saturday. So so I suggest, if you've understood what we have been trying to convey, the perspective and the understanding, if you think you're able to get that, you are in sync with what we have told you, we suggest that you should not delay and start your recovery process. So okay, thank you all of you. Namaste.
Thank you. Namaste, everyone. Night.